Hello, welcome to the Healthcare Worker Safety segment of our Healthcare video discussion series. My name is Felicia Barbara, business specialist focused on the healthcare sector at the Pikes Peak Workforce Center. If you enjoy this segment today, and I think you will, please check out some of the other segments in our video discussion series. Safety on the job takes on a whole new role when the potential risks are hepatitis B, AIDS, or a potentially career-ending back injury. Here today to talk about how healthcare workers can be more healthy and safe on the job are the amazing Frankie Gales with the El Paso County Medical Society. Frankie is currently the Chief Operating Officer at the El Paso County Medical Society. Frankie had her first safety and occupational safety class when she was a private in the United States Army, She recognized that the Occupational Safety and Health Administration was there to help to protect individuals working in healthcare. Frankie devoted much of her 20-year military and civilian nursing career to make sure that OSHA rules and regulations are implemented. Fan that she may be, Frankie is not employed by OSHA. She does meet OSHA's criteria of being so knowledgeable on the subject that she is an OSHA trainer. Not to be outdone is the fabulous Pam Baptiste. Ms. Baptiste is a consultation program manager with OSHA Region 8. She began working for the Occupational Safety and Health Administration in 1991 as an industrial hygienist, conducting safety and health inspections in various types of industries on the East Coast and then in Colorado. Prior to working with OSHA, Ms. Baptiste was the senior industrial hygienist for federal state operations for over 10 years. So I've introduced these two ladies, but Ms. Baptiste, would you please tell us a little bit more about OSHA and the role you play in healthcare worker safety?
All right, certainly, thank you. OSHA is the Occupational Safety and Health Administration. We are a federal agency who is responsible for developing and enforcing workplace safety and health standards to ensure that employers and employees are safe on the work site. OSHA will go into healthcare facilities based on some of our various programs and by complaints. We will go out and we ensure that the employers have instituted the various safety regulations and health regulations that we've put in place to ensure that they are reducing and eliminating the safety and health hazards that workers are exposed to at those work facilities.
I understand OSHA typically has a regulatory perception, but I understand that it's got a very interesting conception.
Yes, OSHA, and most people know OSHA by its enforcement powers, but we also do have another branch of us called the Consultation Service. And each state is required to have a consultation service, and they provide free safety and health visits to small businesses. They will go out upon request from an employer, and they will go out to a workplace, go on site, look at the safety and health programs that are in place, or help you develop them if you don't have any in place. They will go out and also do an on-site visit, look for hazards at the workplace. If they find hazards, they will offer ways to correct those hazards and eliminate them so employees aren't exposed. They will also do employee exposure monitoring for air contaminants or noise hazards.
Is that a very expensive program?
Believe it or not, it is free. It's your tax dollars at work.
Did you say free?
I did say free. And they also do all the exposure monitoring for free, provide you with a written report and an analysis. Also, it is separate from OSHA enforcement. They do not interact, so feel free to use us. Every state, like I said, has one. It's listed on our website, www.osha.gov. So please call them and request a service. You can have safety, a health service visit, or both.
Oh, wow, thank you. And Ms. Gales, could you please tell us a little bit more about the El Paso County Medical Society and the role you play in healthcare worker safety?
Wonderful. The El Paso County Medical Society is a nonprofit organization that represents all physicians from all disciplines and from all sectors, from private practice to hospital settings. And what we do at the El Paso County Medical Society is we provide that forum where they can come together and work together and really work on what our new goal within the medical society is to make Colorado Springs the best place in America to practice medicine and receive medical care by 2020. In particular, we know that healthcare changes are coming, and our healthcare professionals have been asked to do a lot to make sure that they're taking care of patients, but also making sure that things are safe in the workplace with their employees. And so we surveyed our members, physicians, and said, how can we help you meet the needs that are placed upon you? And according to their surveys, they said, you can help us with those tasks that don't require clinical patient care. Meaning, you can help us write those OSHA plans, you can help us enforce those trainings that are required, and really make our workplace a safer environment.
Wow, so as opposed to one practice having to have that be an expert, they are now a part of an entire group that gets to take advantage of your expertise.
Yes. So we actually have a practice renewal team, which is made up of specialists who actually are highly educated about OSHA and HIPAA and things like that. And they go into the practice and they meet with those team members and identify what tasks they're asked to conduct. Meaning, what procedures are they doing in the office? Are they following a protocol so that those procedures are done in a safe manner? A lot of times they are doing them correctly, they just aren't written down. And so we're there to help write those policies and procedures down and then make sure that those policies and procedures are meeting what OSHA's expectations are to make sure it's a safe work environment.
That's awesome. At our collective impact event, healthcare worker safety was something that came up, and it was one of our more passionate groups, which is why we're here today. What, in your opinion, are the biggest challenges that healthcare workers face on the job?
I would say some of the biggest challenges is that they need to protect their employees against bloodborne pathogens, hazardous chemicals, ergonomic injuries, and even workplace violence. So there's a lot of things that they need to protect their employees about and to make sure that it's a safe environment for their patients as well. And so it's important that they use what's called universal precautions, meaning that every time they are working with a patient, they assume that patient has AIDS, hepatitis B, hepatitis C, or some other potentially infectious disease, so that every time they are making sure that they wear the personal protective equipment, the right gloves, or if it requires a mask or a gown, they have that equipment available to them, and it's the employer's responsibility to make sure those employees know how to use that equipment properly. And with that, the employee then has to be responsible and make sure they are using it every single time.
And I think I saw a really interesting synergy between the areas that you said were important and your areas of focus. Ms. Baptiste, would you share your areas of focus again, if that's okay?
And Frankie hit them right on the head there. You know, traditionally, or back in the 80s, 90s, infectious diseases, the HIV, the hepatitis B, was the reason why OSHA got into the healthcare industry. Typically, you know, everybody thinks constructions and fall hazards, but these workers are also exposed to occupational hazards. So over the last 30 years, employers really have come a long way in implementing the engineering controls, removing, or at least doing their best they can to remove the needle sticks, educating employees on what is an infectious disease and how do you protect yourself using the gloves. Initially back then, doctors, nurses, whoever did the healthcare patient handling, did not want to wear those gloves. Now, today, that's an inherent part of the education process, and the medical students today would never even think about practicing and touching a patient without the proper personal protective equipment. So we've come a long way with that. Now, we've also addressed ergonomics related to patient handling, developing, like you said, career-ending back injuries, muscle tears and strains. We're still working on that, but employers are incorporating things like lifting devices, no lifting policies. We're still now today working on workplace violence. It has been in the industry a long time, but it's happening more often, and the media is picking up on it. So I think we're more aware of it, but we're working with our healthcare partners to develop programs and controls to try to reduce those injuries and fatalities, unfortunately, from either combative patients, fellow coworkers, or even very, very upset family members.
Wow. And what would you say is the single biggest obstacle to having a health and safe workplace? Is there one or multiple obstacles?
I would have to say that making sure that the healthcare workers are educated about why it's important to follow the OSHA regulations. So back in like 1983, for instance, there were 10,000 healthcare workers who were infected with acute hepatitis B. So OSHA said what we need to do with the guidance provided by the CDC said we need to make sure that it's a safe environment. So let's have the employees have vaccinations against the hepatitis B series within 10 days and that it's free to the employees. The CDC then also extended out, why don't we make sure that infants are vaccinated against hepatitis B and that school-age children and college students are required to have that vaccination before they can go to schools. So as a result, looking back at that, it was 10,000 people were infected every year with hepatitis B. In 2009, hepatitis B decreased to 100 people in the healthcare setting. So being educated about those procedures that were put in place and following them, they need to just know that they're working. Another one is that in 1983, there was about 800,000 needle sticks every year. And so in 2002, OSHA adopted a needle stick safety program, saying that you should not be recapping any of your needles. You need to make sure that there's safety devices on those needles. You need to make sure that the people who are using the needles have say in what they're purchasing. And so as a result, those incidents has also decreased to about 385,000.
Wow.
They found that those clinics and those hospitals that are regulating that had a significant decrease. But what they found is that in surgical settings where it was not strictly enforced or nearly as strictly enforced, they actually had an increase of 6.5%.
Wow.
So now they're going back and again saying, OSHA put these guidelines in place for a reason. They are working, so now let's really make sure that they're available in all settings, in the healthcare settings, and make it safe for everybody.
That's amazing. So OSHA's basically viewing the data and finding out where the weak points are, sharing that information, and then via education, we're making some significant improvements.
Oh, definitely. And like I said, it's in the schooling and the education now, and people are getting it right off the bat. And a lot of these, I call them kids, but young adults that are entering the workforce, they're already protected against hepatitis B because they got the vaccines as infants.
Okay. As it pertains to personal injury on the job, what kinds of things can healthcare workers do to keep themselves safe, and how can their employers help them?
The first thing is that employees, the workers, they need to follow the procedures and the policies that are in place and then follow the information that they're provided and given in the training. Secondly, we recommend get involved. Join the safety committee. Offer to give training about a particular topic that may be workplace violence. Thirdly, speak or part of the getting involved is if you see a coworker exhibiting an unsafe act or behavior, go up to them and tell them, hey, you're doing something unsafe. Put your personal protective equipment on, or let me help you lift that patient. Let me go get a lifting device. So have them get involved. That's proactive activities to keep your employees safe. If you are injured at work or you see something unsafe, go to your either manager or your safety representative and let them know that I am starting to get some weakness in my hand. That could be a start to some type of musculoskeletal disorder. Don't wait till you can't move your arm anymore. So early, upfront, and also last but not least, practice it. Practice safety at home and on the job.
And as the representative for employers, basically, with the El Paso County Medical Society, what role, how can employers help make sure that their workers are safe?
Well, sometimes it's just knowing what injuries are likely to occur and knowing that half of the injuries occur while they're using the device. So while they're using the needle or the sharps device, or knowing that it occurs between using it and disposing it, meaning that they used it, placed it down, someone else is then responsible to take it and throw it in the trash or throw it in the sharps container. So knowing those kind of things. Also, a lot happens when they're disposing of them, knowing the proper procedure to do that. Also being aware of what devices cause sharps injuries or sharp injuries in their workforce setting. So knowing that it usually is disposable syringes, or knowing that it's suture needles, and knowing that it could also be a blade. Those kind of things, being aware of them, knowing that you need to have your safety devices have the safety, I'll re-say that. Exactly. Knowing that your safety devices need to have the safety feature to protect them after it's been used. and then placing it in a sharps container nearby and not walking across the room to place it in there.
You know, as we're talking, I was expecting to hear about a boogeyman, but it sounds like most of these things are actually preventable.
Yes.
Via procedures and education. Could you tell us a little bit more about the El Paso County, how your medical society program can assist with the safety of healthcare workforce on the job?
Again, we have a practice renewal team, and on our team we have practice assistance specialists who are very knowledgeable about OSHA, and that they go in and they actually meet with the team members and help them write plans. They help them identify what policies and procedures are already in place, and then they make sure that they're being followed. They help implement a training program that all of the practice and all of the members on the team can follow, which is very helpful. There is a cost for it. We're a nonprofit organization, but we still do need to pay the employees who come out and do that. So there is a cost to us. But we work very closely with OSHA. As a matter of fact, Pam and I have given some classes before together, helping out.
Ladies, you've been amazing. So my final question for both of you is, if you had a magic wand, what would be your wish for improving the safety of our healthcare workforce? And I love your goal about making this the safest place for people to work.
I think educating the workers is the first thing, and letting them know that they have a say in their safety and health at work, getting them involved and having them realize it's important and they can have a safe and healthy workplace. If you're looking for a job, going to look for a job, you always look at what's the salary, what are the benefits, the hours, the health, the insurance. But what about the safety record of that employer? Do they have high injury and illness rates or low? Where would you want to work? I would want to work for somebody that cares about my safety and health, and that's one of the first things up front. So I think it's educating employees, knowing that they can go to work and come home in the same condition, and maybe even a better condition that they went to work in, and that also the employers need to take advantage of all the resources they have available to them. The free resources that OSHA has on their website, there's publications on the website we have, there's electronic training tools, there's a great healthcare training tool on there. You can go in there, it's a hospital setting, you can click on various departments that would be in a hospital, and you can see what the hazards are associated with that, with the lab or the operating room and so forth, the kitchen and so forth. So having employers realize that there are things that they can do to make it better for the employees, and it's not going to cost them all their profits that they make in a year.
Pam, if I wanted to find out the safety record of a specific location has good, safe practices, how could I find that out? Are there resources on OSHA?
You can go to OSHA.gov and you can look and see if that particular workplace you're interested in has had a citation. And in about a year, where OSHA is requiring that businesses will submit their injury and illness data to us in hopes that we possibly will make that available to the public, so you can make that informed decision where you either want to work or maybe a dentist or a medical facility that you would want to go to have a procedure completed.
So from the user perspective, I can also use that same data to figure out if this is a safe hospital for me to be in. Oh, that's awesome. So I am now going to share the magic wand with you, Frankie.
Oh, wonderful. I would want to reverberate some of the things that she said, like OSHA's here to protect us and keep us safe. That's really, really important. But I also want people to know that the Medical Society is here to help the physicians that we work for, that we want to be part of their team and make sure that they are providing the safest workplace possible and help them write those plans, and not that they have to do it from scratch and do it on their own. Know that they have resources right at their medical society who are more than happy to come out and help them do that.
I understand there's something pretty special about your program, Frankie.
Yes.
With the El Paso County Medical Society. Are we like one of the first? Or?
We are one of, yes. Felicia, I didn't even follow you. But yes, we are one of the very first medical societies to be doing this. We are not following the traditions of a medical society. We decided that we would really listen to our members and help them in their practices. So this is the first time a medical society is going out into the practices and providing services such as we are.
Okay. Ladies, I can't thank you enough. When the Collective Impact event started, we talked about a lot of different issues, but as we've engaged our subject matter experts, what we've really found is that we've got some fabulous professionals at the forefront of this, and that Colorado Springs, El Paso County, Colorado is a great place to be a healthcare worker. We've got resources like the El Paso County Medical Society that are really on the forefront of organizing practices to make sure that we've got healthy and safe workplaces. So the conversation has started here, but it doesn't end here. Everyone that's watching this has access to a facilitation and discussion guide. Please take this discussion into your workplace, continue it, and come up with your own answers. Thank you so much for sharing your time with us today. It's been a distinct pleasure.
Thank you.